right, yesterday we discussed the rising calls for the mandatory wearing of masks to be dropped in light of lower COVID-19 infections.
And if government, of course, goes this particular route of some other countries, it will then become a choice to wear a mask. But globally, there's a new debate.
Well, it's a good manners and good ethics to wear a mask. Could it become a norm to stop the spread of colds and flu, even if COVID-19 stops being a major concern? Let's discuss now. We're joined by Professor Sylvester Chima from the University of KwaZulu-Natal's College of Health Sciences. Professor, thank you for being with us. My first question to you, if you look into the future, are the majority of us wearing masks?
Well, generally, South Africans and other Africans have been very compliant with the wearing of masks. But recent results seem to suggest there was research that was conducted in Gauteng, Johannesburg, and suburbs, which shows that a lot of South Africans in this have been actually exposed to this virus, and therefore we're approaching a state of population or herd immunity, in the sense that it was shown that up to people who had double immunization had up to 90% level of protection from the virus, and even those who did not have, any history of having been immunized were having up to 60% level of immunization or antibodies to the virus. So there is a possibility that the society itself is coming to a state of herd immunity, which has naturally occurred, and in addition, which has been supported by the use of vaccinations. So this probably would be a good time to start relaxing some of the measures which were imposed to try and control the spread of the virus. And one of those measures would be, of course, the mandatory wearing of face masks.
The question being, if we drop the mandatory use of face masks that is on the cards, would it be good ethics, good manners to still wear a mask?
Well, it will become optional. And the best way to look at it is this. Now, we have said that majority of people, according to this research that was published, that was conducted in Gauteng, majority of the people who had the highest level of protection against the virus were people who were double immunized and also had a natural immunity. So they were, ranging from up to 80 to 90%. Now, those who had never been immunized had a lower level of protection. Now, if it becomes, if the rules are relaxed in such a way that you have the option of not wearing masks or the masks are no longer mandatory, what one would advise, the ethical thing to do would be, now, if you have never had an immunization, perhaps before you take off your mask, it would be a good or a wise decision for you to go ahead and get vaccinated before dropping the mask. Now, if you have had one dose of the vaccine, perhaps that would be a good time to take the second dose in order to, increase your chances on the level of protection. And if you've had your double doses, perhaps it would be good advice or ethical for you to get boosted. So we're getting to a situation where now it becomes individual choices, like it's always been. But in this case, is that you have a better protection if you have been fully immunized and then you drop your face mask, so that if it comes out that we have a new variant of which there's no history of it at this particular point in time that emerges, you'll be better placed to have, natural protection, and you'll be better protected if you're not wearing masks. Now, yeah.
You've raised an important thing, Professor, because there is some writing in the New York Times, there are opinion pieces about the world possibly changing, whereby people start wearing masks when they have flu symptoms, for example, because we now know that it does stop the transmission. We saw a late flu season last year, for example, because we were all wearing masks in June. So some people are saying that they feel ethically obliged to wear a mask if they're sick. But on the other hand, you've talked about herd immunity. That's probably because people mingled without masks. So is there a potential that if people choose to wear masks, they can lower their levels of immunity when it comes to a range of diseases? Is that an issue?
No, that's what I'm saying. We're getting to a situation where I've said one of the best ways, the ethical way to, to think about this from an individual to societal level is that, for example, if you are diagnosed, your doctor can then prescribe wearing of masks, for example, for 10 days or 2 weeks while you are infectious. Or, for example, if you as an individual are traveling to a high-risk area, let's say an airport. It used to be that people who, for example, when the Middle East respiratory virus was diagnosed, you see people walking through the airports, in international airports, and they were wearing face masks, and you wondered, why were these people wearing face masks? Now, it becomes your own personal responsibility. Now, like I said, to boost your own personal protection, in other words, if you feel, since it's no longer mandatory, it will be wise and ethical for you to first get immunized if you have not been immunized, or if you have only had a single shot, to then get a boost, increase the level of this, because that increases the level of protection you have. Yeah. Now, mask wearing or face mask wearing will then become optional in the sense that doctors can prescribe for those who have a breakthrough illness, or those who are, if we're going through a flu season, or those who have high risk, then they can have the choice of wearing face masks to enhance their own personal protection and also protect other members of society.
And Professor, Professor Karim gave us some stats yesterday, also in terms of the reduced transmissibility if you are vaccinated. Finally, my question to you, Professor, is how effective are masks? And I bring this up because of the old controversy when Dr. Fauci in the US was caught saying some masks aren't as effective as the medical masks. There was talk about the size of the virus, and a lot of people still believe that they are useless. How effective is the average cloth mask that we are wearing?
Now, the level of protection has been researched by some people. They have studied it. The highest, the one with the highest level of protection is the N95 masks, and then it starts descending as we go down the line to the point where the cloth mask is probably the least effective. But all masks provide some level of protection, even ordinary handkerchief, because it reduces the level of what you inhale into your nose. So even if you have a cloth mask, even if it doesn't provide you with about 80% protection that the N95 mask would give, it will give you at least 30% or 50% protection. Remember, at the beginning of this pandemic, we had no other means. We only had certain basic things, which are public health measures, face mask wearing, social distancing, maintaining distance from others, and so on and so forth. So that was the initial mechanism. But now we do have effective methods of protection, and the most effective of this is actually to getting immunized. Now, the statistics will show, or the statistics that have been published will show, that those who have been fully immunized and also have been wearing masks have the highest level of protection. So yes, do face masks, no matter what type of face mask, or face coverings, do protect you to a certain extent from all these respiratory infections, but the quality and the ability of the mask depends on the quality, with the N95 being the gold standard, and other masks, surgical masks, for example, coming down the line, and then cloth masks being the least effective. So this research has been done, and it's been proven that it does prevent you spreading and also inhaling infectious particles.
All right, thank you for your perspective tonight. That was Professor Sylvester Chima. He's an associate professor as well as head in the program of bio and research ethics and medical law at the University of